Hi, everybody. This is Dr. Ed Park. I'd like to briefly review 5 years of my clinical experience using exosomes. Note that MSC exosomes are always active in your body when you're trying to heal, but they are not FDA approved. And in fact, all the patients treated had to read and agree to this statement, which is that there's no guarantee the treatment will be effective. The treatment is not FDA approved and does not represent standard of care. This treatment is something I voluntarily requested in the context of my protected patient-physician relationship. So here's a histogram. You can see the most common procedures requested were nasal and then IV. The fingers have a lot of problems. We treated those, the knees, miscellaneous, we'll get back to shoulders. MSK would include tendons, ligaments. Nerve treatments are commonly requested. The face and neck, arterial, epidural for back pain, discs, etc. Wrists, penis, intraspinal hair, dental, and hips. Actually, hips, I think the number is greater, and that's one of the easiest procedures if you have an ultrasound. 2,200 procedures and counting. And the miscellaneous is a lot of different things. We've used it intraperitoneally, transtympanically. We've also done treatments, inhaled nasal, inhaled bronchial. So there's a lot of ways that you can use these. Adverse reactions are important. If you look at studies, things like Tylenol or normal saline sugar, placebo, the numbers are even higher than this for adverse reactions because the mind is a powerful thing. When you go bowling, if you have these bumpers, you feel safe that you're not going to roll a gutter ball. I guess it's possible, but less likely. So the numbers that I came up with for adverse reactions was less than 1%. 3 of those were vasovagal responses, which is someone trying to faint on us. So that could happen anytime they see a needle or blood or get nervous. We treated with ammonia salts. It was okay. One infection did occur in a knee, and that could happen with hyaluronic acid or steroids. The patient had a compromised immune system. Twice I've seen non-phlebitic or non-painful vein swelling, which lasted a day or so, not due to clotting. One time with my mom and one most recently in Hawaii. I have no explanation for that. Other than that, we've had 3 cases of severe herpetic reactivation. That could be oral or genital herpes. One patient had pityriasis, which is a kind of childhood rash on the body, but her mother was dying and her son was being dishonorably discharged from the army. So it was a stressful time, and it occurred a couple of months later, maybe unrelated. Twice we've had URIs, once COVID related. So your immune system will go from surveillance to regeneration. And one of those, ironically, was my mom, who's gotten 36 injections. 3 times we've had serious new injury during recovery, and that was usually because the patients, well, in all 3 cases, the patients felt great, and the lack of pain, the lack of signal of imminent injury, led them to exercise vigorously and injure something else or the same organ. One spinal headache, not an uncommon procedural complication, and not due to the exosomes, but rather putting a hole in the dura mater. One persistent pain at the injection site. This happened a month ago. First time ever that someone got worse in an inflamed bursa. And I have no reports of allergy or anaphylaxis. So because they're so immune suppressive, we would expect that. But again, I've never seen an allergic hypersensitivity reaction. What I would not consider an adverse exosome reaction would be a vasovagal episode. That can happen drawing blood. A new injury during early recovery, that's my fault for not warning them, reading them the Riot Act. Pain going away does not mean you can exercise at a higher level or previous level if you're injured. Spinal headache, again, that just comes with the territory. It could be from a diagnostic lumbar puncture. Also, I would not consider adverse reaction to be drowsy. It's very common for the person to be drowsy for the first 72 hours, and they should sleep a lot. A controlled herpetic reactivation, meaning they call me with some tingling, and I give them Valtrex, and it doesn't really erupt. I wouldn't consider an adverse reaction, more like a result of changing your immune expression. And a URI exacerbation. Just 2 days ago, I had a patient who was scheduled. He said, I have a cold with a fever. And I said, let's cancel, because when your immune system gets exosomes, it goes from surveillance to recovery, and that can exacerbate an acute URI or upper respiratory illness. So just like a knife does not cause you to cut your fingers, but you have to be careful. These are procedures, and procedures carry with them risks. So the Black Knight was something I used in my lecture to explain that people are always getting worse. They think they're getting better, but they're not. And as we get older into our 80s, 90s, the systems are being depleted of functional immune cells. Everything is depleted. So when we talk about response rates, we have to talk about in relation to what? Rarely does a person go back to being, well, I would say never does a person go back to being a 15-year-old. So if the pain goes away, that doesn't mean you're back to being a young teen. When we talk about response rates, we have to discuss recall, follow-up interval, like when did you follow up with them, and attribution bias. I've done blogs and videos about this. It's a major problem. Just 3 days ago, I got a call from a patient with Lyme disease, and she was lost to follow-up. I called her. She never called me back. And in fact, she says, please come treat me again. Last time you did my lumbar epidural, I was able to walk. My neck got much better. I didn't know she was better. Again, the follow-up interval was a couple of years. When you have something that's very severe, complex, and chronic, that's also a factor. I mean, is someone really going to come back from advanced Alzheimer's? Probably not. The cost value perception also factors well into the response rate. Did the person think it was worth it? That's going to cloud their judgment as to whether there was a response. Rarely people do say there was no benefit. That's 10 to 30%, depending on if they're really saying it wasn't worth the money. But about 70+%, it gets a little better, but it wasn't enough for them. And that's fine. So we have to manage our expectations as clinicians. Recently, in my trip to New York, I actually had the first patient who said something got worse. She had some bursitis, and she was expecting, complications. And indeed, we had the situation where she doesn't feel better, she feels worse. But those are pretty good numbers for any therapeutic intervention. What are the most common results? Well, highly effective would be injury inflammation post-op. In other words, if you get a burn, if you have an acute gout flare, or you've just had orthopedic surgery 10 days ago, these are highly effective. Accidents, falling out of trees, falling off horses, these are some of the best cases we've seen in healing because the inflammation takes the exosomes exactly where they're needed and where they're being used. So moderately effective, I would say, is mild osteoarthritis in the joint cartilages, usually the knees, the shoulders. Autoimmune conditions almost always get better. Usually effective, I would say, facial rejuvenation as an adjunct, meaning if you're getting laser, microneedling, Morpheus. Erectile dysfunction, good results, and tendinitis in most cases, usually effective. Intermittently effective, unfortunately, nerve damage. Sometimes you just can't regrow that nerve. Sometimes you can, which is amazing because we really don't have anything for that right now. And hair restoration, perhaps I'm doing it wrong. I'm not offering enough packages, but my results have been less than impressive. Other people claiming better results. Question I get asked a lot is about dosing. Now, you have to be very careful. The recent video you can find on quantifying exosomes suggests that the brand I've been using, the only brand for 5 years, is 800 times the potency of other brands. So we're really comparing apples and oranges. These are guidelines I use. The company no longer uses billions in their marketing or branding. Although I am privy to some inside information, I continue to think of them in terms of billions. A little may be enough, a lot may be better, a lot may not be that much better. No one really knows. But the general guidelines I use are 1 to 3 billion for like a single tooth, hand tendon, epicondyle, like tennis or golfer's elbow, 2 to 6 billion for a single joint, nasal treatment, subacromial bursa, meaning the rotator cuffs, erectile dysfunction, face and hair. Go bigger, like 6 to 18 billion if you're looking for systemic effects, anti-aging, and to treat autoimmune disease. And 24 billion plus, you could argue, in cases where there's been a catastrophic injury, multi-system failure, for example, DIC from a respiratory illness, or a massive car accident, perhaps even heart attack or stroke. That's really all I wanted to share with you. It's very safe so far, knock on wood. And if you have questions, you can email me. That's my contact QR. You can read my book, Exosomes, Songs of Healing, and you can download 5 years of educational blogs and videos. I haven't updated to include the last year and a half, but you can do that at my contact info for free. And I've just offered on the website free Zoom consultations. You can do that by going to Recharge Biomedical/contact us, and you can download a form, book a 20-minute interval, and we can chat about whatever is ailing you. You can also subscribe to my YouTube channel, Dr. Park 65. And if you're a doctor or provider, you can join my masterclass and have access to training, to my protocols, and a community site, which I'm building right now. And it should be up, and people can share private information, clinical pearls and tips, and experiences. The provider course is 12 hours online, and I do provide local training to providers in the 5 states where I'm licensed. So that's it. Exosomes seem to be helpful. They're not FDA approved. Anecdotes, nevertheless, for the people involved are extremely meaningful. And I think we're just getting started on really having a very powerful healing modality. So Dr. Ed Park from Recharge Biomedical, thanks for your time.